Human resources in the health sector are stretched thin, but as countries grapple with the increased need for healthcare professionals, stakeholders from across the Americas came together during the 61st PAHO Directing Council in search of solutions. Joel Crosskill provides that report.
The establishment of an international recruiting unit to engage healthcare professionals amidst growing demand was considered during the 61st PAHO Directing Council, which concluded on October 4 in Washington, D.C. Minister of Health and Wellness Dr. Christopher Tufton, who led the Jamaican delegation, continued his call for reform in the management of human resources in the health sector.
The reality is we can't train health workers fast enough for them not to be recruited or for them to migrate normally to the United States, but to Canada and the UK. This is because there's a global shortage. So we have been saying in these halls that more needs to be done around collaboration, and that collaboration must address the bottlenecks, which includes things like clinical rotation, space, and faculty.
The final report on the Plan of Action of Human Resources for Universal Access to Health and Universal Health Coverage 2018-2023, presented to the Council, included Jamaica's own efforts towards the establishment of an international recruiting unit to engage healthcare professionals.
What we're coming out of these discussions with are the possibilities of MOUs being signed between countries to coordinate around training. As you know, we're building out a lot of infrastructure in Jamaica, hospitals and health centers. We're adding more services to these facilities, and what that means is that we need more people. And one of the big risks that we face is that we won't have the people to man these facilities when we're completed.
In addition to bilateral arrangements with countries like the Philippines, Nigeria and India, the development of a 5-year policy and action plan in conjunction with PAHO, projected for finalization this financial year, are also being sought. Dr. Tufton highlights the need for creative and collaborative solutions to ensure Jamaica's and the United States' own ability to meet the healthcare needs of their populace, championing a flexible contract arrangement that would allow for temporary, freelance and seasonal working arrangements as another potentially viable solution.
We can't stop the mobility of labor, but we can certainly coordinate to expand what is available. And as you know, we have been advocating for the possibility of a flexi contract to provide persons going back and forth to at least fill some of the voids that we have.
Joel Crosskill, CVM News.